Hi Julia, hi Shayla, hi Simona. We're here after a very intense day dealing with brain health and brain research in the context of the Science Summit within the General Assembly of the UN in New York. What is your takeaway from today's discussion? And I'll probably start with you, Julia.
Well, I would certainly say that I was impressed by the minds that were here, and I was also impressed by the real desire to make a change, bring people together, and truly affect policy within the next so many years, and not a very long time, actually. So,
thank you, Julia. Shayla?
I think for me today, understanding just how significant the cost of brain disorders are and the need for countries to really start to prepare themselves and making sure that they are allocating the resources that are necessary for an aging population.
Thank you. Simona?
I agree with everything that's been said already. Maybe just one thing to add is how aligned we all are in understanding what a challenge this is and how aligned we all are that we must do something about that.
And Shayla, in seeking that alignment, obviously the IHME has produced very compelling data that were presented this morning. I'd like to ask you, what is the crucial elements that would need to be addressed when it comes to brain health in your perspective?
For us, I would say that the most important thing that's missing is data, and making sure that those that are making decisions that are based on sound data and evidence, and not cherry picking how they decide to implement interventions and policy making.
Thank you. Julia, I'd like to come to you from a patient perspective. What do you feel would be the most important or the most relevant policy action that we would need to implement to drive a change from your perspective? And what impact is it likely to have?
well, first of all, I think that quick diagnostic code creation for new and even rare diseases, are very important. Patients also need to have consistent and really effective treatments across the board, and no matter what country they're in. And I think bringing people together will allow for those kinds of policies if they're to be universal for patients to really do the best they can do.
Thank you. Simona, from your perspective, why is collaboration, which is a word that was mentioned, why is it so important in your eyes?
I think I said the word collaboration so many times today already, and I really believe that the challenge is complex, and without diverse stakeholders that collaborate and bring each other along, I think it's not possible to make short, mid, and long-term change. So for me, complexity of this challenge drives the need for collaboration. I think I said it's not a choice, it's a necessity to collaborate.
Thank you. I'd now like maybe to conclude with a few words to ask, in your perspective, and Julia, you mentioned this is like a battle for many, many years, but what would be the next step and the next challenge we have in our journey? Julia?
Well, that's a hard one because there are so many challenges. I would say that simply getting organized and getting something started. And I see you have several other meetings coming up, and one thing that we're poised to do is to pay attention now. We had no idea actually before I was invited into this world that this existed, and it's very exciting for us as MOG patients. And so I think that that's probably for us the next steps, but we're looking forward to what you guys do in the future.
Thank you. Shayla, from your perspective?
I think that we will be going back to IHME and being able to connect with the people that we met today and understanding what their data needs are, and then how we can further support them to, as Simona said, to collaborate further.
Thank you. And Simona, what would be the next steps from your perspective?
I think we need to take action. I think we of course we painted all the challenges, but I think we need to make first steps and make progress. And one of the things that I'm very excited about is actually with our ability to measure that progress and have some kind of index that would help us determine how quickly and how extensively we're making that progress.
Awesome. Well, on this conclusion, I'd like to thank the three of you, not only for having attended today, but also having contributed so actively in making today's a success. So thank you very much, and I look forward for this collaboration to be brought to fruition. Thank you.
Thank you.
Thank you.